Another form of acne scar treatment is the laser resurfacing. One of them being the CO2 laser resurfacing, and I'm going to talk about this. I'm a very big laser person, and I love the lasers. As you can see, just in this room, we have multiple lasers right here. There are many different types of lasers that are used for acne scars. Traditionally, in the past, the two forms that were used is called the Erbium laser as well as the CO2 laser. They've been around for many years, like over 30 years, and both are pretty much very effective. So today I'm going to talk about the laser I have, which is the SmartXide DOT by DEKA. This is a fractional CO2 laser. The CO2 laser is the gold standard in the industry. So when a patient who is more on the lighter skin type, Caucasian, comes in and they have acne scars, this is probably the first type of laser, the first type of procedure that I'm going to recommend. The way it works is that the patient comes into the clinic, we put topical numbing on, and then we do the procedure. It takes about half an hour to 45 minutes. Over the years, we've gotten really good at numbing the patient. So we put topical numbing on, and we also give Demerol shot, which is a painkiller to the patient that reduces the pain. The whole point of the laser is that to stimulate basically collagen production. So as the laser basically shoots a beam into your skin, it vaporizes the skin, and also it adds heat to it, stimulating collagen production. So within 3 to 6 months, you're going to see the benefits of the laser. Sometimes patients need several sessions depending upon the energy that's used as well as the skin color. So right now we're just going to demonstrate basically how the laser resurfacing works. So if this is basically the patient's skin, we're going to hold it right here. So the way the laser works is that it's going to drill a tiny hole. If you guys could see that, it drilled a tiny hole, very, very tiny small holes, basically into the skin. And by drilling those tiny holes, it vaporizes those areas, and also it's putting heat into the skin. So right now we're at a pretty low setting. This is just for demonstration purposes only. But that's how the laser works. And what we do this all over the skin in order to vaporize the skin and also stimulate collagen production. Now, a lot of patients get the benefits of both wrinkle removal as well as acne scars simultaneously at the same time, and also remove some of the brown pigmentation as well. A question that's typically asked about laser resurfacing is that what's the difference between the laser CO2 laser resurfacing along with another procedure that I always do, the TCA Cross technique? Well, there's a lot of difference. The laser is literally vaporizing the skin and putting heat into the skin, whereas the chemical peel, we're just adding the chemical peel specifically into those acne scar areas. Both of them are used to stimulate collagen productions. Some patients respond better to one than the other, and a lot of times we don't know. The CO2 laser, you have to stay out of the sun, cannot be tanned, you have to take antibiotics and antiviral basically for about a week, and you have to treat the skin with Vaseline and sometimes vinegar soaps for about a week. So you have a downtime basically with the CO2 laser resurfacing. However, if you're under lighter skin color and we could basically treat you aggressively, you have amazing results. With the TCA procedure, TCA Cross technique, is a much quicker procedure. You don't need much preparation. You come in, it takes 10 minutes to do in the office. Your downtime is only about a week, basically of just scabbing. You really don't have to do much anything afterwards, and it's also more affordable. And in my opinion, it works great for some of those deep box-like scars, especially on the temples, on the lower cheeks. So each procedure has own benefits and advantages and disadvantages, and it really depends upon the type of acne scars you have, your skin color, how much downtime you could afford, as also basically the cost as well. So all of those play into which ones I usually recommend. Again, in my practice, I used to do a lot of laser resurfacing, and I still do a lot. However, I truly believe that if you were to do several sessions of TCA Cross technique, that will boost the stimulate collagen production in those acne scars, and you'll end up with better results. So typically what I do now, I recommend several TCA sessions followed by laser resurfacing to smooth out basically the skin once some of those acne scars have filled in. Thank you so much for listening.